Thank you very much, Chairman Tester. Quickly, Mr. Vizarani, what steps are you taking to get compliance with the statutory 365-day sign-up? There are some circumstances which you can't, i.e. someone is terminated from duty prior to that time period. But what are you doing specifically?
Senator, one of the things that we're doing is we're in the process of integrating a single data repository that will allow for that measurement and providing that information back to the military services and to commanders. And when we think about the accountability portion of this, we try and think about this not accountability necessarily from a punitive standpoint, but from what can we learn? Are we understanding best practices, and are we sharing those best practices across the services?
Well, thank you. One of my experiences is that the transition from uniform to civilian, DOD to VA, the most challenging aspect is medical health care. I recall going up to Walter Reed in 2000, visiting and finding people who were there for 6 or 7 months trying to get their VA eligibility or disability status to a level that meets the military level. And the other issue, just the first step, have we successfully combined electronic medical records between the VA and the Department of Defense yet?
Senator, the Department of Defense has completed our deployment of the electronic health record within CONUS, with the exception of the Lovell Center in Chicago. And we're working with our partners at the VA to implement that. We're taking all of the lessons we've learned through the CONUS implementation and applying that to ensure that we have a successful implementation at Lovell.
But we're not operational yet, are we?
We are not operational between the two systems. However, we do have visibility. So there is a sharing of information between DOD and VA. So while the electronic health record is not operational, there is a sharing of information to coordinate that care and ensure continuity of care.
Well, I would encourage you, I mean, this is slightly off topic, but not entirely. I would expedite that. It's been going on now for a decade or more, and that would, I think, help smooth out the transition dramatically. And what are the primary choke points, Mr. Jacobs and Secretary, between VA in terms of health care? I understand that VA does a separate independent disability assessment, is that true, that differs from the Department of Defense?
We have a joint program called IDES when a service member when they have a condition that impedes further service, where we can do a joint disability process. But for anyone applying for VA disability compensation, that's a separate and distinct approach. And the benefits that we provide in terms of disability compensation are not only a recognition of the impact of the individual's service, but they're also a gateway to other benefits. They impact healthcare eligibility and the criteria, the priority group within healthcare. It also can inform eligibility for other benefits and make connections.
But the reality is that a DOD physician could give someone an 80% disability rating. The VA would independently rate?
We are providing independent assessments based on our rating schedule for disability compensation purposes.
I think that's something that deserves further coordination and maybe even legislative support. I think that would be helpful. I thank you. I know this is a very challenging situation, but the other point too is, I presume, and I'm exceeding my time just very quickly, there is a mandatory information session on medical health care opportunities that's specifically designed for the retiring veteran?
Yeah, so in the one-day VA TAP course that we provide, we include information about health care in addition to the full suite of other benefits.
Thank you.